Imagine being in pain so bad you can't stand up, but everyone around you says it's just your period. Imagine bleeding, vomiting, missing school, missing work, missing life, and being told you're dramatic. What if I told you that pain is not normal, and millions of women are silently living with a condition they were never taught about? Today, we're talking about endometriosis, not to scare you, but to give you clarity, power. And if you're here because your periods feel too painful, too heavy, or too disruptive, this video is for you. Let's talk about what endometriosis really is, why it's often missed, and what you can actually do. What is endometriosis? Endometriosis is a medical condition where tissue similar to the lining of the womb, called the endometrium, grows outside the uterus. This tissue can grow on the ovaries, fallopian tubes, bowel, bladder, or pelvic walls. Here's the problem. Every month, this tissue responds to hormones just like your uterus does. It thickens, breaks down, but it has nowhere to go. That leads to inflammation, internal scarring, chronic pain, and sometimes fertility challenges. This is not imagination, it is real. Symptoms people ignore. Endometriosis doesn't look the same for everyone, but common symptoms include severe menstrual pain that stops daily activities, pain during or after sex, chronic pelvic or lower back pain, heavy or prolonged periods, painful bowel movements or urination during periods, fatigue that doesn't make sense, difficulty getting pregnant. And here's what breaks my heart. Many women live with this for 7 to 10 years before getting a diagnosis. Why? Because women's pain is often minimized. Why painful periods is not normal. Let me be very clear as a medical professional. Pain that disrupts your life is not normal. Mild discomfort? Yes. Pain that makes you faint, vomit, miss school, or fear your next period? No. Your body is communicating, and pain is a message, not a weakness. Now, what causes endometriosis? We don't have one single cause, but science shows strong links to genetics. It can run in families, hormonal imbalance, especially excess estrogen, immune system dysfunction, early onset of periods, short menstrual cycles. This means if your mother or sister struggled with severe periods, pay attention. Now let's talk about what you can do, because knowledge without action is frustration. 1. Track your symptoms. Don't just track your period. Track pain, bowel changes, fatigue, and mood. 2. Advocate for yourself. If a doctor dismisses your pain, get a second opinion. You are not being difficult, you are being responsible. 3. Hormonal management. Treatment may include hormonal therapy to reduce estrogen stimulation. This must be guided by a qualified healthcare provider. 4. Nutrition matters. Research shows anti-inflammatory diets can help reduce symptoms. Reduce ultra-processed foods. Increase omega-3s. Focus on fruits, vegetables, and whole foods. 5. Pain is valid, but don't self-suffer. You deserve comfort while seeking long-term solutions. Let me say this clearly. Endometriosis does not automatically mean infertility. Many women with endometriosis conceive naturally or with medical support. Early awareness and proper care change outcomes. This is why talking about it matters. If this video sounds like your life, you are not weak, you are not dramatic, and you are not alone. Your pain deserves answers, your body deserves respect, and your health deserves attention. Share this video with someone who needs permission to take their pain seriously. This is women's health, and we are done suffering in silence. Subscribe for more honest, science-based women's health conversations. Drop a comment if this resonated with you. And remember, your body is not the problem. The silence is.